Proper immunization of animals is one of the key points of Prrs control because it will allow to reduce the recirculation of the virus on farms and therefore reduce the incidence of Prrs episodes. Once the infection gets into the farm, and depending on production system, there could be a population of pigs susceptible to getting infected, and consequently, there will be virus circulation that can cause clinical outbreaks if pigs and breeders are not properly immunized. Active immunization of animals seeks to homogenize herd immunity status by minimizing the amount of animals prone to getting infected, as well as the number of animals that spread the virus. Immunization should confer cross-protection against the farm strain. When cross-protection is good, levels of viremia, virus excretion, and clinical signs are going to be lower in vaccinated animals compared to non-immunized ones. Consequently, infection pressure is going to be reduced. Immunization can be performed by wild virus exposure that targets the induction of homologous immunity against the farm strain, or by vaccination that targets the induction of heterologous immunity against the farm strain but also against the new strain. Wild virus exposure represents always a risk since animals get infected with pathogenic strain. This praxis is becoming less popular since it induces problems due to the lack of control on the amount of virus injected per animal and the lack of control of other pathogens contaminating the serum. On the other side, live vaccines are safe and do not represent any risk for animals. Different studies have demonstrated that immunization by vaccination stabilizes the farm faster and cost of outbreak is lower in comparison to wild virus. From management standpoint, the use of vaccines greatly facilitates immunization. Using wild virus exposure, the virus has to be obtained from different biological materials, which involves much more complicated handling, inducing errors. Before vaccination, it's important to decide which is the target population to be vaccinated, as well as the vaccine program to be implemented and the expected benefits. Sow vaccination will improve reproductive performance, such as abortion, fertility, farrowing rates, amount of born alive and weaned piglets, and pre-weaning mortality, among others. Moreover, piglet vaccination will diminish mortality rate and the virus load on their tissues. A remarkable improvement on growth rate and feed conversion rate and mortality rate is observed. Different vaccine protocols are suitable when vaccinating sows. This protocol consists of vaccinating all breeding animals, sows, gilts, and boars, on a specific moment and repeating it 3 to 4 times per year. This protocol delivers maximum homogenization in the sow population's immune status. It should be considered that this is the protocol of choice in the case of Prrs outbreaks, since it will enable us to stabilize the population more quickly than other programs. This could be the protocol of choice on farms where infection pressure is low. It consists of giving 1 dose of vaccine in the 2nd week of lactation in each one of the sow's reproductive cycles. This protocol has certain advantages, such as the possibility of mixing the vaccine with the parvovirus erysipelas vaccine in cases where this indication exists in the vaccine. Finally, this is a 2 shots protocol. The most notable characteristic being a dose is administered just before mating during the sow's 2nd week of lactation, and another one around day 60 of gestation, just before the most critical period of gestation. This practice is the one that delivers highest vaccination pressure. To decide the vaccine program, it is needed to know the herd status of the farm. The shedding, serological and clinical status of the herd will help to classify farms within one of the 4 herd status: positive unstable, positive stable, provisional negative, or negative. Moreover, knowing how good or bad the biosecurity of the farm is also necessary to decide the vaccine program. Mass vaccination is the protocol of choice in all positive unstable status farms, regardless of their biosecurity. In positive stable status farms with bad biosecurity measure, there is a high risk of infection by heterologous strains. In this case, it is advisable to keep at least a 3 shots mass vaccination protocol or 2 shots vaccine protocol per reproductive cycle. In positive stable status farms with good biosecurity levels, a single dose in lactation would be considered. Moreover, this type of farm could even address the possibility to drop or reduce the vaccination pressure under certain requirements. In provisional negative status farms, despite the fact that virus circulation within the herd has been eliminated, it will be highly advisable to keep a good vaccine pressure if biosecurity is not good. Finally, vaccination can be removed from those provisional negative status farms, which have high biosecurity measures and pursue to eradicate. The objective pursued in piglet vaccination is for the animal to be properly immunized before infection takes place, striving to make sure that maternal immunity interferes as little as possible. It should also be remembered that onset of Prrs immunity is 4 weeks after injecting the vaccine. Hence, the ideal vaccination frame is between 2 to 4 weeks of age. In conclusion, vaccination is the best tool for immunizing animals on a farm, and therefore for providing these animals with protection against the recirculation of the farm's homologous strain, as well as against the arrival of new heterologous strains on the farm.